Hey, it's Dr. John Mark Chesney here, licensed physical therapist and owner of Simply Physio. We're currently documenting a case of a patient, a pickleball player. She's 4.0, diagnosed with a medial and lateral meniscus tear, and she is getting back to the pickleball court through means of stem cell procedure as well as physical therapy treatment. And I was reading over her instructions from her stem cell doctor, and I found some interesting information here, something that I think could spark some conversation and even just education. So, after her post-op instructions, in particular, says no ice for 6 weeks, and it says that heating pad is okay. So this is probably contrary to most people's understanding or experience with after having a procedure when there's pain and swelling and or inflammation involved. Typically, what you would expect is to use ice, after to control the swelling. But again, what they say is no ice for 6 weeks. Now, some of this is related to the procedure itself, but some of this we could apply potentially to other injuries. So I want to talk about more related to the stem cell procedure. So the stem cell procedure, in essence, what they're doing is they're creating a micro injury and using the stem cells to help to regenerate that tissue, improve the healing process of that tissue. But they're creating a micro injury intentionally, right? So that's part of the procedure, is to create an injury. So now that they've created an injury, what they want to encourage is the inflammatory process. And so inflammation, the inflammatory process after an injury, is part of the design of the healing process. You want that initial stage of that inflammation to occur because it's the body's way of bringing healthy tissue, healthy cells into the area to help continue this healing process. And without that initial stage, what would be lacking is just those healthy cells that encourage the healing process. So especially after, again, having a stem cell procedure, is they want to do everything and set the tone for all the healing to occur and to optimize that. So again, what they're recommending is no ice for 6 weeks due to the natural occurrence of the inflammatory stage. So what they have in the instructions is what they kind of categorize is for the first 7 days, they consider it more the inflammation stage. And this is from their protocol reading off. It says, during this period, other healing cells are being recruited to the area to begin the healing process. During this stage, you may have swelling, pain, and redness. This initial inflammation is temporary and good for healing. So anti-inflammatory medications should be avoided. So again, this is specific to a stem cell, but has some application as well to other injuries. And begs the question is, hey, so after I've had, let's say I tweak my knee, I hurt my shoulder, have a specific injury, I usually go and grab the ice pack. Why? Because one, it's kind of just what we do, right? And ice does have a numbing effect, so it does have some benefit, if there's significant amounts of pain. But what we have to consider too is ice will slow down circulation. So the application of why people think about using ice is they want to they view the swelling of in the area associated with inflammation to be a bad thing, and that we want to stop the swelling. But if the swelling is a sign of the body bringing healthy cells to help facilitate the healing process, would we in fact want to prevent that from happening? And that's what ice potentially will do, is to slow down the circulation, to slow down the swelling and the inflammation, where we could restrict the joints, the tendon, the area from actually getting those healing cells into that area to facilitate. Counter to that is heat, right? So heat has the opposite effects. It's going to help encourage circulation, helps encourage just fluid flow, and that can actually be of some value and benefits right after an injury. So just some food for thought, maybe again counter to what you have typically been heard by even the medical community. But I found that interesting that again this is coming from the orthopedic physician practicing both surgical procedures and in this instance regenerative medicine with the stem cell. Encouraging the not using ice after the during the healing process, but actually to use heat instead. So, hope that encourages some thought, some questions in that regard, and maybe experiment for yourself. Always, again, consult with if I don't know any particular ailment or injury or issue going on with you. So, consult the right people in your specific situation. But wanted just to share this information regarding my current patient as she's going through stem cell procedure as she's getting back to the pickleball court. All right, guys, thanks.